Hi everyone, my name is Tara Cumming. I'm a nurse practitioner and have been working in urology for the past 5 years. I currently practice at Texas Urology Group in San Antonio. Prior to this, I worked at Vanderbilt University in the urology department where I subspecialized in urologic oncology. It was at this time that I was introduced to Cysview and given the opportunity to join the nurse support team. My experience with Cysview is in a clinic setting, working to educate patients, their families, as well as other members of the healthcare team who aren't as familiar with Cysview. I'm skilled in patient selection as well as follow-up care and symptom management in patients who elect to undergo blue light cystoscopy. When getting started with rigid blue light cystoscopy, my biggest piece of advice is to keep it simple, not sophisticated. In order for the procedure to flow, you will need to involve several members on both the administrative and clinical side, so straightforward is best. Identification of a nurse champion, physician champion, and process champion were all important parts of our process. The nurse champion to lead training of the pre-op, intra-op, and post-op nurses. The physician champion to lead the learning curve among their colleagues, as well as develop policies and procedures related to Cysview. The process champion had perhaps the most important role. This team member walked through as though they were a patient presenting to undergo TURBT. We were then able to identify every individual that the patient came in contact with, thus helping us to identify who would need training when it came to implementing blue light cystoscopy. From a scheduling standpoint, this was also beneficial, allowing us to track approximately how long the patient was at each location during their procedure from start to finish. Next, we will talk about key points of the procedure. In our facility, the OR pharmacy reconstitutes Cysview. Foley catheter placement and administration of Cysview is performed by the holding room nurses. PhotoCure works with these team members to provide tips and tricks on reconstitution and administration. Scheduling takes place in the clinical setting by our surgery schedulers. This is typically done in person following a visit with the physician or advanced practice provider. PhotoCure provides surgery schedulers with literature such as tear pads and patient education. These serve as excellent resources for the patient and reiterates what was discussed at their office visit and can be helpful when the patient returns home and may have questions about their upcoming procedure. Next, we will talk about tips for creating smooth processes. Our facility finds it helpful to clearly flag blue light cystoscopy patients at their initial check-in. The board in the OR holding room clearly displays this information, making it easier for our pre-op staff to identify these patients and bring them back sooner as their prep tends to be a little bit more involved. Scheduling is also an important piece when it comes to blue light cystoscopy. We are mindful not to schedule a blue light case as our first case of the day. As I mentioned previously, the pharmacy is responsible for reconstitution of Cysview. The medication cannot be made several hours in advance, so you can see by having a blue light patient as your first case, you could create some delays for the rest of your day. Additionally, early morning was the busiest time of the day for our OR pharmacy, so we found that mid-morning tend to be a better time frame. We found that by starting the first case of the day with a standard TURBT and then stacking 3 to 4 blue light cystoscopy cases thereafter was most efficient from a scheduling standpoint. Because the towers for blue light and white light differed, it was important to have these cases stacked so that turnover for the OR staff was also easier. As we know, working with any equipment can come with its challenges at times. We found it helpful to have at least 2 dedicated cystoscopes, especially when stacking those 3 to 4 cases in a day. This helps OR turnover and makes it seamless. It's also helpful to have a backup should there be any issues with the scope. Implement a plan up front for equipment challenges because no one wants to be stressed and scrambling the day of. Coordinate with your Karl Storz representative when starting out in the OR to assist with any training. Like any new process, it can take some time to master new skills. Our facility found it helpful to perform a few blue light cases consistently every week for at least a month. Keep in mind that nursing and OR personnel change shift every few days, and by about a month, we seem to have the majority onboarded. It took about 3 months for everyone to be comfortable with the procedure, so keep in mind this is a learning curve for all. Blue light cystoscopy has increased our patient satisfaction, and patients are reassured that they are receiving a high-quality exam. I hope this information is helpful as you begin utilizing rigid blue light cystoscopy in your practice. Thank you for your time.
Cysview is an optical imaging agent indicated for use in the cystoscopic detection of carcinoma of the bladder, including carcinoma in situ, CIS, among patients suspected or known to have lesions on the basis of a prior cystoscopy, or in patients undergoing surveillance cystoscopy for carcinoma of the bladder. Cysview is used with the Karl Storz D-Lite C photodynamic diagnostic (PDD) system to perform blue light cystoscopy, BLC, as an adjunct to white light cystoscopy. Cysview is not a replacement for random bladder biopsies or other procedures used in the detection of bladder cancer. Anaphylactoid shock, hypersensitivity reactions, bladder pain, cystitis, and abnormal urinalysis have been reported after administration of Cysview. The most common adverse reactions seen in clinical trials were bladder spasm, dysuria, hematuria, and bladder pain. Cysview should not be used in patients with porphyria, gross hematuria, or with known hypersensitivity to hexaminolevulinate or any derivative of aminolevulinic acid. Cysview may fail to detect some malignant lesions. False positive fluorescence may occur due to inflammation, cystoscopic trauma, scar tissue, previous bladder biopsy, and recent BCG therapy or intravesical chemotherapy. No specific drug interaction studies have been performed. Safety and effectiveness have not been established in pediatric patients. There are no available data on Cysview use in pregnant women. Adequate reproductive and developmental toxicity studies in animals have not been performed. Systemic absorption following administration of Cysview is expected to be minimal. There are no data on the presence of hexaminolevulinate in human or animal milk, the effects on a breastfed infant, or the effects on milk production. The development and health benefits of breastfeeding should be considered along with the mother's clinical need for Cysview and any potential adverse effects on the breastfed infant from Cysview or from the underlying maternal condition. Cysview is approved for use with the Karl Storz D-Lite C photodynamic diagnostic (PDD) system. For system setup and general information for the safe use of the PDD system, please refer to the Karl Storz instruction manuals for each of the components. Prior to Cysview administration, read the full prescribing information and follow the preparation and reconstitution instructions.